Today we will be showing our adaptive product for scoliosis, which is a modified backpack to relieve the pressure off the shoulders onto the torso. Scoliosis is the sideways curvature of the spine, which affects 2% of the American population. Though that number may seem small, this malady affects millions of people. Although the cause is unknown, it usually occurs during growth spurts before puberty, or can also be the result of cerebral palsy or muscular dystrophy. To summarize the physiology of the disease, the brain miscommunicates with the muscles around the spine, creating unnecessary pressure, which results in many symptoms of scoliosis, such as uneven shoulders, rib hump, leaning torso, degeneration mostly in hips, shaking, trouble balancing, and leg and back pain.
Scoliosis can present itself in many different forms. Congenital scoliosis results when scoliosis occurs in patients after birth through age 10. It is caused by the spine developing abnormally in the womb. The most common type of scoliosis is idiopathic scoliosis. Idiopathic scoliosis occurs in adolescence and has an unknown cause. One of the postulates of it is hereditary, because of the patterns of scoliosis in family history have been discovered. Neuromuscular scoliosis has a side effect of a neurological or muscular disease, such as muscular dystrophy and cerebral palsy, and progresses quicker than most types of scoliosis. Degenerative scoliosis occurs in adults and is the result of gradual deterioration over the parts of the spine.
Currently, no cure for scoliosis has been discovered, but some treatments exist to prevent the condition from worsening. One treatment is spinal fusion, in which the curved vertebrae are fused together with bone grafts to stop the worsening of the curve. Bone grafts are made to copy the bone healing process by causing an increase in bone production to help the vertebrae heal as one. Metal rods attached to the spine using screws, hooks, and wires are normally used to hold the spine in place until the vertebrae are fully fused together. The fused portion will remain permanently stiff. The surgery normally lasts 4 to 8 hours, and the patients are hospital bound for 7 days. Out of school for 2 to 4 weeks, and prohibited from sports and other physical demanding activities for 2 to 6 months. Otherwise, back braces are used to prevent curve worsening.
Diagnosis also varies upon type of scoliosis. Children are normally diagnosed with scoliosis near the ages of 8 to 12, while adults are diagnosed around 60. Upon initial diagnosis, scoliosis doesn't cause immediate concern, but unfortunately it worsens over time. Diagnosis rests on a spinal curve of more than 10 degrees, which is typically seen with x-rays because patients are usually asymptomatic at early stages. Sadly, treatments or prevention measures do not exist at these early stages of scoliosis, so patients must wait for conditions to worsen to receive treatment. Some of the later stages are severe yet rare, resulting in curves greater than 70 degrees. These patients also suffer physical deformities, malnutrition, and increased pressure on the lungs, heart, and abdomen. Moreover, pressure on the internal organs may cause difficulty breathing, fatigue, and early fullness after eating. Our mission is to alleviate some of this emotional and physical pain with an adaptive product to ease common strains of life and physical burdens.
Our product is the backpack. It is a specially designed backpack directed towards children and adults suffering from scoliosis. Because backpacks are a necessary school item for every student, most parents look for the most comfortable backpack for their child to suit their needs. But for children with scoliosis, there aren't as many good options that don't look too different from standard backpacks. However, the backpack has specially designed straps to help relieve pain backpack straps can cause. Excess amount of weight on the back and shoulders creates unnecessary pressure on the spine. A normal backpack may be carrying 18.4 pounds of work that the straps distribute onto the shoulders and upper back, which is painful for scoliosis patients. By contrast, the straps of our product wrap around the torso and distribute some of this pressure off the shoulders and back so that not all the pressure rests on the affected area of the scoliosis.
It's customizable to fit every specific patient's needs. It attaches across the torso in a snap. The shoulder opposite of the curve has an armhole to offset the curve and transfer some of the pressure. The arm strap will then be attached to the side. This normal look is our focus, so children won't be embarrassed to wear it.
Standard, medium to higher quality backpacks generally cost around $30 to $50. The backpack will cost about $45 because the bag itself is just like any other backpack, and the straps will be made out of a similar material, they just have different shape and orientation. And we didn't want to make the backpack unnecessarily expensive because of the benefits it'll bring to people with scoliosis, but we also couldn't make it too cheap because of profit margins and because of the multiple strap options.